Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medispa. Welcome again to our Facebook Live event, and this is our first one of the new year and the new decade. Tonight we're going to discuss how to achieve a better buttock aesthetics. So buttock aesthetics has been increasingly growing in popularity over at least the last 6 or 7 years. I see at least 1 or 2 patients a week that want to at least come in and discuss it. And what I've found is when I'm discussing and interviewing these patients, I find that there's a lot of misinformation out in the social media and on the internet about what fat transfers, buttock lifts, and really what it's all about. So we wanted to start the new year out kind of educating everybody as to how to achieve a buttock lift or buttock aesthetics. We're going to talk about fat grafting, what's real, what's not real. And so, as everybody knows, I like to have special guests on the show. And tonight we're going to introduce our newest member of Bellissimo. This is Angela. Angela graciously decided to model for us tonight. So we're going to use the mannequin to kind of show where the placement of the fat transfer would be the most aesthetic outcome for a buttock transfer. So we'll kick off tonight. If you have any questions about it or interested in it, please let us know. Type in your questions. We'll be happy to answer them for you.
Why do you believe fat transfers have spiked in popularity in recent years?
I think that as we've gotten better at fat transfers, and we've been doing fat transfers just like skin grafts for several decades now, and as the equipment and the technique improves, so does our outcomes. And so I think people are always interested in using their own body to enhance or to take away from another area. So the word we like to use in plastic surgery is repurpose. So in other words, we can take fat from one place and repurpose it to another place to make that other place more favorable in shape.
Once the fat is harvested from another area, will the fat grow back in that area that you removed it from?
Oh, that's a great question. So when you liposuction, and that's how we remove the fat from an area, is we actually remove it using a cannula and a suction technique. Once that fat is gone, those fat cells are completely gone. It's not going to grow back. Now, the fat cells that are remaining, and this is why liposuction is not a weight loss program, it's a contouring program. So in the same thing, the fat cells that are left behind can also gain in their size, and as you gain weight, they will also gain in bulk. So liposuction doesn't prevent you from gaining or losing weight in the future, so you do have to be careful, but the fat that we remove is completely gone.
How do the results of a fat transfer to the buttocks differ from implants to the buttocks?
I think that I'm not a fan of buttock implants at all. I haven't done them. I don't see any reason to do them, at least at this time. Buttock implants have always had issues with infection, pain, migration, extrusion. So they've had their own issues. So if I'm going to choose one versus the other, I'm always going to choose a fat transfer. When you can remove tissue from one area and then put it in another area, I think that's going to be a better outcome for you. The chance of having infection after a buttock transfer or any kind of fat transfer to the face, the buttock, any other contour deformity of the body, the breasts, I think the infection rate is extremely small. You're not going to have extrusion. You're not going to have migration, and I think it's a better way to go. In my opinion, it's safer. Especially if you're going to somebody who does it and understands the anatomy, because there can be issues, just like in any surgery, for people doing something that they don't have the experience to do. That being said, I think at this point, the biggest sort of myth about or misinformation about a fat transfer is that you have to remember fat is a living tissue, meaning it has a blood supply, it gets oxygenated, so it's alive. Wherever it's sitting, it's in its own environment or milieu. When you remove that tissue, and you've now separated from its environment or its vascular supply, so it's not getting any more blood. So wherever you put it, that tissue has to quickly reestablish its blood supply, otherwise it will die off. So I think the biggest thing when I talk to the patients that come in, The idea is that you can just suck out a big syringe full of fat from the belly or the hips and just basically push it into the breast or the buttock as a huge bolus or a big ball of fat, and almost like an implant, and get the effect that you want. You can't do that, and I think that's when patients come in and I start telling them this, that is the thing that shocks them the most. You really have to take it out. We take it out in syringes. There's different ways of separating the fat and spinning it down or letting it kind of decamp by gravity. There's different devices. So to concentrate the fat, once that happens, to put it back in, you actually have to use a very small cannula like this, or even smaller if you're putting the fat into a face. But this cannula here is about 2 millimeters wide. So the fat you have to actually place into long strings, and the finer the string, the more chance that this tissue is going to get revascularized. Picture in your head a sponge, and so what you're doing is the sponge, the inside part of the sponge, that's the tissue that you're going to be placing this fat transfer, or this small stream of fat. All of that tissue has a blood supply. So you're putting this cannula right through there, and as you're pulling it out, you're kind of pushing in small amounts of fat. The thinner, the more successful you're going to be for the fat to actually reestablish its blood supply. If you put in a big ball of fat, only the outer part of the fat is going to get revascularized. The fat that's on the inside of that ball is now going to die, and that's where the issues come in. That fat can calcify, it can turn into oil, and you can have pain. That's when you might have an infection. You can develop a cyst. That's where the problems come from. So when you do this, there is a limit to what you can put in, because you can't put in too much tissue from one area to another, that you overpopulate, and so you basically oversupply what the new blood supply can maintain. So as you aspirate from here and you put it anywhere else, the face, the breast, the buttock are the most common areas, you have to lay it in very thin lines so that you can establish the blood supply.
How long does this procedure take?
Depending upon where you're putting it, how much you need to transfer, most of the time, if you get it down, for those of us that do it a lot, I think most of the time we can do it in about 1.5 to 2 hours pretty safely.
And you mentioned, where do you typically take the fat from on a patient when you're doing a fat transfer?
Most common areas are abdomen and hips. So we would take it basically from all of the area in here. You would take it from the hips, both here and in the back. And so that usually gives us enough fat. Now, here's one of the limiting steps. I have a lot of young ladies that will come in and say, I'd like to transfer it to my buttocks. A lot of ladies are now inquiring about fat transfer to their breasts. And these ladies come in, they're very thin, they're healthy, they're exercising. The problem is you don't have the fat to transfer. So, you can't steal from Peter to pay Paul if Peter's poor. And so that's the key, is you have to have enough tissue to harvest. The other thing about fat transfers is, in the reality of it, only at best about 70, maybe 75% of what we transfer will actually reestablish his blood supply and what we call take or survive. So whatever we put in, at best 3/4 is going to survive. So fat transfers usually take not just one, but sometimes 2 or 3 procedures to get the full effect, because what you put in, you might get on one side 75%, you might get 60% on the other side. So you can develop some asymmetry. And these are the things that the surgeon should be discussing with you as a patient, because when you understand what can happen, you can really rethink, is this right for me, is it not? So I have a pretty good amount of patients that will do the surgery, but I also have a fair amount that will say, oh, I didn't know that. Maybe I'll just do breast implants instead, or some other type of procedure. So you have to know that that's just real. So if you do, once you harvest that fat, let it heal 4 to 6 months later, you can go back and reharvest and put more fat in. Now, if you're somebody who doesn't have a lot of fat, you might only get one shot at it, because you might only have enough fat just for one go around. So these are the things that the surgeon needs to be talking to you about. And then the aftercare, and we'll talk about that, because that's really important.
Well, I was just going to ask you, what is the recovery process like for a fat transfer patient?
Okay, we'll jump into it now then. So once you do the surgery, as I tell patients that come in, especially when we're talking about, tonight we're talking about buttocks more than anything else, but It takes about 6 weeks of really a lot of babying and care so that the fat cells can sort of reestablish that environment. So if you're talking about the buttock, no sitting, no lying on it for 6 weeks, no exercise for 6 weeks. So you're laying on your sides, you're kind of sitting on a pillow that kind of that's on the back of your thighs, so your buttocks off. Pressure is the biggest enemy of this because you compress that fat, and just like if you pushed on your skin and you let it go and it kind of turns white, you're compressing the blood supply to that tissue. Sitting on your butt, you're going to decrease the blood supply to those cells. They're not getting enough blood supply, and they're going to die off, and now you don't have the same amount of take. So depending upon that, you really have to baby it for 6 weeks. Breasts are a little bit different, a little bit less. Face is a little bit less as well than the buttocks because you're not laying on your breasts so much. You'd have to sleep on your back. Your face, you'd have to lay on your back as well. Again, pressure kills those fat cells.
Is the fat harvesting process painful from the areas you've harvested? Do they have pain based
Very
on?
little, actually. It mostly feels like you've kind of gotten beaten up a little bit or like bruised. It's not really painful at all. So most of the time, Motrin, ibuprofen after surgery is almost enough. Some people need a little bit more like Norco, but lots of people just use regular ibuprofen.
Is there a difference in the fat taken from the abdomen or the thighs? Is there the fat different?
Yeah, that's a good question. Fat is a little bit different as it is in other areas of the body. So we have something called donor site memory. And so what that means is that as you take fat from the belly or the thighs, that might react differently to fat taken from the arms. It also reacts differently than the fat wherever you may put it. So think about it, as we get older or we're not working out, where do we gain the most weight? Around the belly and around the hips. So if you take that fat and you put it in the face, as we get older, our face loses, for most of us, we lose fat in our face. So we take fat from the belly, put it in our face. When you gain weight, that fat will gain weight from the area from which where you took it. So if you gain weight and you're a little bit older, your face doesn't plump up like it used to. But if you put fat from your belly in there, it's going to now because it's going to respond to where it came from. So it might be a little bit of difference in concentration or density of the fat. So usually around the hips and abdomen are the best place to go. That's where I like it the most. And we'll talk about sculpting the buttock area in just a little bit. Thighs have good fat, but it's not. Sometimes it can be a little more fibrous, and it may not be as dense as the fat in the belly. So it's a little bit harder to use or to inject.
What is the difference between a Brazilian butt lift and the traditional butt lift?
Well, traditional butt lift is really altogether different. The Brazilian butt lift, it makes it sound like we're cutting and everything else. So basically, if Angela would just turn around here just a little bit. So the Brazilian butt lift is actually the colloquial name for fat transfers. So basically, this is where the aesthetics of the buttock really come into play. And I've seen lots of different ways that people have done it. So if you actually look at somebody and the aesthetics of a buttock, most of the fullness of the buttock is centrally in the central. It's almost in an oval, right in here, right along the inner part. The outer part of the buttock does not have a lot of fill to it, and so it's almost kind of full here, and then as it just sort of tapers off to the side of the leg. I've seen patients come in from other surgeons that have come in, and it just basically they're putting fat everywhere. And it's not very aesthetic. It's the old-fashioned bubble butt. The problem with that is you don't want a wide butt, you want a projected butt. Just like you don't want wide breasts, you want a projected breast. This has a limit, just like your breasts have the limit to the lateral side of the chest wall, right in front of the armpit. So does the buttock. So you concentrate and put most of the fat here, and then you sort of feather it out in this direction so you achieve a nice projected shape. But if you're putting it out here, think about functionality. Here you are trying to put on a pair of jeans, you've got this large bubble butt. How do you pull the pants over that fits your waist, which is a lot smaller? You can't get the pants up over that. If you buy pants now to fit pulling it up over the hips or the lateral thighs and the buttock, Then when you pull it up, now you got this big gapping waistline. So it's not very functional and it's not very aesthetic. But if you put it in the right position, it's a very aesthetic. You want to achieve that nice curve. So when you harvest fat, part of the result of the Brazilian butt lift, or the fat transfer to the buttock, is really taking away the tissue that shouldn't be there. So a lot of people have fat up in here in the posterior, the back part of their hips. So they're carrying a lot of weight here, not as much there. And so what happens when you look at them, it looks like their buttocks starting way up here on their back and it's real flat. Part of the sculpting of it is really taking away everything around what you want to add to and just define it. So I do a lot of aggressive liposuctioning and harvesting in this area, leave this alone, harvest from here, sculpt it down here. Now, without doing any transfer, your buttock actually has a better shape and looks more projected because you've taken away everything else that was obscuring the projection of the buttock. So now you don't need a liter of fat. You might need 300 or 400 cc's just to put into this area, and sculpt it and feather it out into here. Now it looks more projected. You can pull your pants on. You have the nice, beautiful curve from the back of the hips onto the buttock. The key thing is now, you hear me talk about balance all the time, especially in breast surgery. The balance of the breast from top to bottom, side to side, also from balance from side to side, breast to breast, but also does that breast match your body habitus? Here's the next part. If you look at a woman's shape, you also want to have the curve in the front and the curve in the back to be in balance. So when you're heavy back here and not here, you look or unbalanced and misshapen. So some women augment here, some women need to augment here. And so, but you don't want to have this larger than this, so you don't want to overpower one versus the other. What you're trying to achieve is balanced aesthetics, and that's where the outcome really comes into. Now, your question was really, what's the difference between the two? So the Brazilian butt lift is fat transfers to the buttock. The typical buttock lift is what we do when we actually cut, and Angela actually has a pretty good scar here, when we cut along the upper part of the buttock and bring all of the tissue up. Now, that's really kind of a specialized surgery that we don't really do very often unless you're somebody who's lost a lot of weight. And so the reason for that, patient with gastric bypass, gastric sleeve, diet and exercise, however you achieve that weight loss, what we find is instead of having all this weight in here, everything starts to sag, and now instead of the buttock starting right at the lower posterior part of the hip, it starts way down here. So that buttock actually needs to be pulled back up into a better anatomical position. So that actually requires cutting and pulling it up. Now again, that incision is critical to how the overall aesthetics. Remember, the buttocks are round, they're projected, but the top part of the buttocks is sort of this dome, this oval. Traditionally, we're taught to make an incision straight across to do that butt lift. The problem with that is when you pull that up, now the butt is truncated and it's flat at the top. It's not good aesthetics. So really what you want to do is actually make a curved incision down like this, almost in that thong sort of way that, when manufacturers are designing clothing for women, that shape that they have, that's there because it enhances the shape of the buttock. So our incisions should do the same thing. So I don't cut straight across, I cut in a curve so that when you're done, that buttock has a rounded shape. Now those patients might need fat transfers because they've also lost volume here. The problem for those patients is that they've lost volume everywhere, and technically they don't have enough fat to do that. But again, the shape trumps volume in many people, so we want to increase or enhance the shape of the buttock, and then we try to augment it with as much volume as we can if it's available.
So you had suggested that a Brazilian butt lift can actually create a more defined waistline. if you're contouring the patient?
Absolutely. For me, that is more than half the battle, is defining that waistline. Because again, if you look at something and it's almost like doing a sculpture, if you take away what shouldn't be there, what you want left behind is actually much more aesthetic. So we want to take away that area here that's heavy, bulky, and is overriding or overpowering the projection of the actual buttock. Once you take that away, the buttock, without doing anything else, actually looks better shaped and more projected.
So what is the recovery like? Again, you said they must be laying on their stomach.
Mm-hmm. So they have to be, so when they sleep at night, they either have to be laying on their stomach or on their side. When they're at work or doing computer work or just kind of lounging around, they either have to be sitting on a specialized pillow that kind of lifts them off. So the pillow would be more here so that the buttock is hanging off the back of the pillow. And driving, and same thing, you can put that pillow on the car seat. When they leave the surgery center, we have it planned, so they usually have a car big enough they can lie on their side on the way home.
So do you talk with the patient about how much fat you're planning on, the shape to add to the patient, and where you'll be taking those, where you'll be harvesting it?
Yeah, absolutely. It's part of the discussion. Many patients have contour deformities of their buttocks, so it's not only that it's flatter, but there's some little divots that we can try to fill in. So we mark all of that. One side can have more fullness than the other, just like any other body part. So you might be putting more on one side, more on the other. The nice thing about it is, so for me, the procedure is, patient comes in, if I'm going to harvest from the abdomen and the hips, I have them sort of supine or face up on the operating table. I do the harvesting as much as I think I need. Then I flip them on the operating table and put them face down. Now I can sculpt and take this away, sculpt what I need to frame the buttock, and while I'm doing that, my nurse and my scrub tech are on the back table preparing the fat so that when I'm ready, now I can go ahead and harvest it or place it into using that cannula and a syringe, putting it where I want to. And then we can put more on one side, but you're seeing it. So what I do is it's very balanced. If I put 100 cc's on one side, I put 100 on the other, and go back and forth, adding it mostly to those areas that need it, and then the overall. So you really kind of keep looking at it as you're adding it. The nice thing is we can do all that before the swelling starts, so you get a pretty good, accurate look at what the final outcome could possibly be if all of that fat takes. Now remember, if you put in more than the body in that area can handle for blood supply, you can actually cause too much tightness, and again, now you're compressing the fat and you're closing off its blood supply. So when I'm doing it, as I feel that the tissue starting to get more tense, then I just sort of back off, and then I'll be done for the day. And we can come back at another time, 4 to 6 weeks later. 4 to 6 months later, and do it again.
So they would see the results between 4 to 6 months of where they might want more fat.
Correct. They'll actually see it before, but you sort of have to let everything soften and because the shape will constantly improve for about 6 months. But you'll know in the first 2 to 3 months whether you need to go back or not.
Let's shift into achieving a better shape with Kybella and address with the banana rolls.
Mm-hmm. So classically, the banana rolls, this is the hip or the love handle, and that starts back here near the spine and moves forward. The banana roll is classically this roll underneath the buttock. So right as the upper thigh meets the buttock, some people have a little roll here, and it's just an anatomical structure for them. 2 ways to go about it. You can liposuction that, or you can add Kybella. So if you're not going to the operating room or you do not want to have liposuction, adding Kybella injections can actually help dissolve it. We've talked about Kybella in the past at some of our one of our other Facebook Live events, but Kybella is basically deoxycholic acid, which is one of the salts in bile, which is stored in your gallbladder. So when you eat, and especially a fatty meal, your body will put this deoxycholic into the intestine and will help break down the fat. Basically, it dissolves the outer membrane of a fat cell, and then the fat cell just dies and it just spills its contents. So that's how Kybella works. Kybella, you have to do a series of them, depending upon how much you want to dissolve. It might take 2 or 3 treatments on that, about a month or so apart, 4 to 6 weeks apart. And then the amount that you inject each time depends on how much you want to dissolve.
Post-treatment, is it the same where they would not be able to sit on their buttocks or?
Well, the Kybella is only to dissolve an area, so I'm not worried about them sitting on it because I'm not worried about trying to keep the fat alive. I mean, we want that fat to be dissolved. So it does swell for a few days. It is tender, so sitting might be an issue for the first few days. But in that sense, you don't want to sit back here, so you might want to sit more on your buttock and keep your thighs off of that seat because the pressure can hurt or put pressure on that area and you can feel that tenderness. It's not horrible. It feels, again, like everything's kind of bruised for a few days, and then you're back to exercising and back to your lifestyle pretty quickly.
And again, going back to liposuction, you had talked about with contouring. Do you find that some patients just need liposuction to achieve a fuller buttocks?
Instead of the fat transfer?
Mm-hmm.
I think sometimes patients, when they're coming in just for liposuction and the areas they want to target are hips, abdomen, and thighs, a lot of them do comment that their butt actually looks better because now we have sculpted and removed all of the tissue around it that was obscuring its shape. So yes, I think it's always a good thing. And so for me, when I'm liposuctioning this area, I'm trying to achieve, again, that nice curve. So when I'm looking at, am I done liposuction here, what's my end point? It's really when I achieve that nice curve to the top of the buttock. And same thing down here, I want to have a nice curve coming the other way as well.
How much fat would you say you remove during a liposuction procedure? Does it just depend on the shape?
You mean to transfer?
Mm-hmm.
It just depends on the shape. It depends on what the patient really wants as volume, how much volume they already have, also how much they have to give. So that's something, again, when you're considering this, you really need to be with somebody who does it a lot because you need to get a feel for it. As a surgeon, you need to be able to have a feel for how much to remove, how much is there, and how many stages you think it's going to take. So you need to talk to the patient about that. If there's any other questions, you feel free to send inquiries to our website at www.bellissimoplasticsurgery.com. I thank you for joining us. I hope this was educational. I hope it helped kind of clear the air on what's real and not real about fat transfers. But let us know. Next month, we're going to be discussing a breast procedure. So I get a lot of patients that want to know, what's the difference between augmentation, breast lifts? Do I need a reduction? Do I need, an augmentation and a lift? So how do we sort through that? As the surgeon, how do you kind of go through that with a patient? So we're going to talk about that next month, and we hope you join us then. So thank you for joining us, and Happy New Year. Hope it's starting off well for everybody.